Good morning to you. Time now for this week's Health Matters. I've got Lynn Szabo, PA, in our community. She's actually here in the house. How you doing this morning?
I'm doing good.
So we're starting today with with defining terminology.
Yeah, because my notes are kind of backwards because it's confusing.
Okay,
So-
well, what's the topic? What are we discussing?
Okay, we're talking about third jab / booster shots.
Okay.
Two different things.
Okay.
So even though the notes, everything is written backwards, we're going to try and get through this.
Okay,
So,
I gotcha.
So the first thing is that a third jab is what some of us kind of went up into Oregon to get, kind of under the radar. But that's we were initially immunized early in December and January, and there was some concern that even though the vaccines are excellent, that there was waning immunity in terms of the antibodies.
Right.
Although we don't even know that antibodies really count as a measurement of immunity, and that B and T cells are probably more important with durable immunity.
That is something I think that the general public out there, when they're talking about antibodies and immunity, just has no concept of. Everybody is just equating
Right.
antibodies with immunity.
Right. And I've seen a lot of antibody results even numerically, and they're a little bit hard to understand.
Because they seem to be kind of all over the place, right?
Yeah, they're all over the place, and they seem to drop pretty fast. And does that mean, what does that mean? But anyway, third jab. So I got immunized, let's say, late December, and the second one was late January. So I got my third jab, I would say, about a month ago.
And the third jab being not, I don't want to get into not a booster shot, but a third jab is just the third iteration of another
Right.
iteration of the two you'd already
Right.
received.
And
Yeah.
so what they thought at the time was that some people with immune deficiencies maybe weren't responding to the vaccine as well as they could, and they needed the third jab. Okay. And then a booster shot is defined as probably what we're going to be talking about in like December. My hope is it's going to be a revamp of the messenger RNA and maybe J&J to be more delta efficient. So booster shots are probably not going to be that now. I'm kind of hearing that what we hoped is probably not really the reality.
Whoa, okay.
But so what I'm talking about now is what's happening hopefully on September 20th, and that is a third jab.
Okay, September 20th. What's the importance of that date?
So September 20th, the Center for Disease Control has okayed Pfizer, so people who got Pfizer, to get their third jab if they are 8 months out
Okay.
from their second jab. So, right now they have very specific immune criteria for the third jab. But they also have the last one on the list is kind of any immunocompromised, which is pretty vague. I mean, you could argue somebody who's just over 80, otherwise healthy, might be immunocompromised.
Yeah,
so
yeah.
They're kind of trying to make the rule writers and the rule benders both happy, I think. Is what's going on with the CDC.
Is there any sort of indication? It sort of seemed like in the initial inoculation push, they came out with all of these, these people, this group, this tranche of people, this tranche of people. And after a while, and especially here in our community, it seemed like all of that just kind of went out the window and people were just going to get their vaccinations.
Right. But if, I'm trying to get aged parents immunized, and I'm learning a lot about what's going on in the Bay Area and then daughter in LA, and they actually are really sticking to those rules. And they're, if anything, have a tighter control on it.
Okay.
Because they don't recognize any immunocompromised. So I've seen that list be a lot of different things.
Okay.
So it's kind of hard to say. But on September 20th, Pfizer is going to start giving out a third jab if you are 8 months after your second jab.
What about, I believe we're all Moderna folks in here. What's that mean for us?
Yeah, Pfizer is like the A student, and although Moderna is maybe more effective against Delta, Moderna doesn't hand their homework in on time or something. But
Nice.
they didn't get their data together in time, and they're thinking a vague couple weeks after September 20th, Moderna is going to be available for the same thing.
And again, for the folks who are 8 months out from their second shot. Okay.
Yeah, 8 months out. And you don't, at this point, you only have to meet the age criteria for the vaccines in general. So Pfizer, okay for teenagers, but there's probably not going to be very many teenagers in that situation.
Right.
And Moderna for adults. So, anyway, very confusing. And then what about J&J? You know, the redheaded stepchild. J&J booster third jabs are on hold. And it looks to me like from the data and from the articles and stuff that J&J is kind of and also ran, you know, got the participation award, but isn't really in the running anymore.
Why?
I don't think so. Because the effectiveness is so
Really?
much less. However, they're talking about getting a second jab for J&J. That's been talked about almost since the beginning.
The J&J vaccinations, that's a totally different
It's a whole other product.
technology
That's more
Right.
the classic vaccine
The
or
mRNA,
vaccine.
right?
Right. But it's weirdly kind of never really discussed, or maybe discussed as kind of an afterthought.
And I forget, what's the effectiveness rate for the J&J?
Like 66.
Oh, okay. Okay, so
Yeah.
just compare, which isn't bad for a vaccine, right?
No,
I mean,
it's really good for a vaccine.
But it's nowhere near, yeah.
No, it's
Okay.
nowhere near.
wow, wow. Nice try, J&J. Thanks for playing.
Yeah, so
Here's your participation
kind of what they're hoping is that people that got J&J will get start a round of messenger RNA.
Okay.
So either Pfizer or Moderna. Okay. And so the third jab's supposed to be the same shot.
Quick question, just a little sort of thing. Dive in. If you've got the J&J shot and you're going to go back for an mRNA booster, are you going back for the booster, or do you need to go back for the initial vaccination?
No, you're going for the initial vaccination.
Gotcha,
So
all
that
right.
would not be a booster.
Okay.
Yeah.
So, okay, all right. So, does the booster have to follow along the initial vaccinations? Is that something that, I mean, is that medically? Is that what has to happen?
Booster. Think of a booster as kind of like you got your tetanus shots when you were a kid.
Sure.
Okay. And then you're I don't know 50 years old and you step on a nail and you haven't had a tetanus shot for greater than 10 years. Then you get a booster. That's what a booster is.
But that booster is different than the initial
it's different
vaccination.
than the initial
Gotcha. That's what-
vaccination series.
All right.
Yeah, it's supposed to be the same shot. So if you were Team Pfizer initially, you should stick with Team Pfizer. Although if you switched out for some reason, that's okay. Not to worry.
Which one do you do then? If you've got one and one,
Well, I'm kind of Team Moderna.
you lean toward that one, yeah, okay.
Yeah,
okay.
because I think it's slightly better against Delta.
Right.
But that doesn't mean that then, like, how about Moose coming up, right? I mean, really, you could lose your mind thinking about all this.
Well, you can only go as far as theta.
Yeah. And I, well, yeah, sure. Yeah.
That's when we're done, right? When
Yeah.
we reach theta, then
Yeah,
COVID's over.
I don't know. That's not the model established by hurricane names.
Oh, yeah, good point.
Yeah, they start over again or something. But you know, and in Europe they of course do AstraZeneca, and then your first AstraZeneca, then with a second follow-up messenger RNA. So.
Oh wow, okay.
Yeah, but we can't do that here. We don't have AstraZeneca. I don't know why. That's kind of an interesting question. But side effects. So if you got Moderna and you had a good immune response with the second shot, your side effects with the third shot or the third jab are going to be kind of similar,
To the second.
although not quite as bad as
Okay.
the second. That's
Okay.
kind of the experience that people have been documenting. And remember, we don't call that the shot making you sick.
It's your body doing what it's supposed
We
to
call
do.
that being relieved, that you're getting the message from your immune system that it's doing what we're asking it to do. So they likely are going to start immunizing healthcare workers for boosters, older adults and residents of long-term care facility. And now that they've established this pattern, you'll see this pattern repeating. That's not really a surprise.
No, that makes sense.
So once again, does this mean if we have to get a third jab that the shots aren't working? Or if we have to get a booster that the shots aren't working? No, that means that they still work really well, but we're trying to figure out how we can use them to our maximal advantage. And so that's why you're seeing this kind of, and all this discussion, because there's also a lot of stuff that isn't really known yet.
Lynn, one of the things I keep hearing people say is that we're really never going to get rid of COVID. I mean, it's going to be more along the lines of like flu,
Yeah.
where we'll likely
It's
be
just
getting
there every year, yeah.
it's just there, and we'll be
Right,
getting
yeah.
like an annual
Right.
vaccination.
Yeah, we still actually have the influenza virus from 1918. Now it's morphed over time, so it's slightly different. Now we call it H1N1. So, yeah, that's the case. It's gonna adapt to us by like not killing us immediately, and we're gonna adapt to it to try and keep ahead of it with the vaccines. Now, the public health measures might, like with the mask and the distancing and stuff, might someday go away, or might only be seasonal.
Right, and yeah. I see, and I think that's what I'm hoping for. Is we all get into the habit during cold and flu season of wearing these masks around, because we had 4,000 influenza deaths last year, something like that.
Yeah, not very many.
No.
I mean, too many, but not very many.
Yeah, exactly.
I think there was only one child that died, which is amazing to me.
Wow. Yeah.
And because people were taking all of these precautions related to COVID, which then protected them against flu.
And we saw that. A lot of people who said that they mistakenly thought they had COVID in like December 2019 and then January, February 2020, what they actually had was a really bad influenza. And that, it was kind of amazing to us, and in kind of the general just discussion about healthcare providers, is that influenza was in a huge wave and then just dropped,
just gone,
just disappeared with the hunkering down and with the masks and stuff, and people washing their hands. So there was a lot of humorous speculation about that. So more than probably 1.5 million people have snuck under the wire to get the extra dose. And although we get chided, because I was one of the ones that did it, we get chided initially, then everybody wants to know how we did it, and they all go do it. So there's certainly, we have to remember that goals are different. So politicians' goals are different than public health goals, are different than individual goals. Okay, so my goal is to never get sick, which might not be realistic. Public health goal is to not have me in the hospital on event, which, I support too, but my goal is actually more stringent. Political goals are, I think, in some circumstances, just to make the whole thing like a benefit for their political view and to the detriment of the community as a whole. So, but we could argue that. So that's what's going on. September 20th, if you got 2 Pfizers and you are 8 months out and you are in the right age groups, September 20th, you're making that face. So then it should be available at all the usual places, the public health department and the pharmacies. If you are waiting for your Moderna, it sounds like just a couple of weeks. Okay. If you're immunocompromised, my hope is that if you're got a messenger RNA vaccine, that you're already had your 3rd jab. If you meet the criteria, and remember, parts of the criteria are really vague. So you can discuss it with the best person who can answer your questions, which would be your primary care provider.
Excellent.
Okay. And I want to rip in really quickly on flu shots. Yeah. So I think eventually flu shots and COVID shots are going to be morphed into the same shot with the messenger RNA technology, but that's not happening this year.
Okay.
So flu shots, I have not actually seen them in clinic yet, but they should be here, I would think, any day. My personal advice is to get immunized in mid-October to late October, and I know people have had exception with that, but let me explain to you from the acute care PA worldview. For the last 3 years before we had COVID, we saw a double wave of influenza every year, which was, when it first happened, was considered really unusual. And the first wave comes in almost to the day at Christmas, and I think it has something to do with travel.
People try,
travel at Thanksgiving. And I always blame college students too.
Yeah, it's good to blame them. They need
sure, why not? And then the next wave we see is a pretty big one at the end of March and kind of the beginning of April. So the flu shot is supposed to, and I'm talking about your classic flu shot, so not necessarily the messenger RNA, because that hasn't been invented yet, right? So it's supposed to last for about 6 months. If you want to avoid the end of March, beginning of April, second wave, which for 3 years looked like it was establishing itself as a real thing, then you should get immunized in like mid to late October.
Wow, okay.
And I get that the CDC says something different, and I get that the public health department says something different.
They're saying what? As soon as they're available, go get immunized?
Yeah, and actually some pharmacies are trying to sell it as early as August.
Wow.
Sometimes. I haven't seen that yet this time.
Mm-hmm.
But I think from an urgent care, I will say the walk-in clinic, when it was in its heyday, saw 60 to 100 people a day. We knew it was in the community because we saw it all day long.
Mm-hmm.
So the second wave is not pleasant.
Mm-hmm.
And people who were immunized early were most of the people that made up the second wave.
Wow, okay.
So this is not a data-driven thing. This is
Experiential.
This is a PA observation thing.
So,
yeah.
like last year when you said that, there was I got a phone call. I got pushback from somebody in the community who was in healthcare, and her husband, I guess, had heard you say that and was just saying, I'm not going to get my flu vaccination till mid-October, and she was beside herself because she makes him get it much earlier every year.
So once again, there are the rule makers and the rule benders, and so I chose to wait a little bit because I didn't want to be sick in April.
Okay, yeah,
So,
and again, just based on your own experience
right.
here locally with what
and
happens.
as a healthcare provider, going through a flu season is kind of, it takes a toll on your mind, on your body, and I just wanted to make sure that I was covered for that particular time.
Right.
I get that there's no rule written, but it's not an uneducated view.
Gotcha. Okay, thank you. No, thanks for that clarification.
Yeah.
So as people are coming up on their 8th month of their second jab,
We're talking
with
about COVID
yes.
again, yeah.
Is there any reason why they should or shouldn't get that and a flu vaccine in close proximity?
Well, I used to say early on in the vaccination effort with COVID that you shouldn't get vaccines within 2 weeks of getting on either side. So 2 weeks before, 2 weeks after getting, and they're kind of backing off on that a little bit. But, I think if you can time it, why not do it that way? I mean, they're definitely talking about having both vaccines in the same jab probably in the future. So I don't think that that's as worrisome as they initially thought it was going to be. But right now, just working with what we have, you might want to separate it. There's also a lot of people, especially, I don't know, in clinics and pharmacies who, it's not really their job to be up to date with every single detail of it, and they might give you misinformation. So you could question it if you're told that, because that restriction fell by the wayside, but it's probably not unreasonable to try and follow it until somebody's more definitive. It's kind of a swirling mass of confusion. So, yeah. But a flu shot, there early on we noted that people that got flu shots were less likely to get COVID. And when we didn't understand what any of this meant, every healthcare provider I knew updated their flu shot. We all do stuff that we don't necessarily talk about, with patients, but we're trying to do in an uncertain time. We're trying to keep ourselves going so that we can kind of provide care. And I don't think it's secret, but a lot of people, for example, do zinc and quercetin. A lot of people do vitamin D3. All those recommendations were done really early on by healthcare providers. And they're all on YouTube. MedCram talks all about that. Yeah, but
I don't know what quercetin is.
Oh, quercetin? It's a bioflavonoid, I think. But what that means is it's an enhancer that helps get zinc into the cell. And zinc has some ability to block viral infection of the cell. And you can go down to Wild Rivers and get it. And if they have it, I was looking for some in Humboldt County and looking for some online, and it's kind of hard to find. I suspect that a lot of people are going for it. So.
All right. Anything else?
No. We'll see what next week brings us.
Okay. How you doing?
My test is negative as of yesterday, and I'm actually pretty content at UIHS and also today teen clinic. I'm thinking we should have a new theme there: cookies and condoms. So, so we can feed the teens after they get out of school. They can just cross the street, get some refreshment, and a little bag of condoms to go. So I'm going to launch that today.
Excellent. No, that's good.
Yeah, look for us on our Instagram.
That's wonderful. So cookies and condoms at the teen clinic. So how are things? I know we probably will end up doing some content about the teen clinic here if we ever get through Delta and all of this stuff. But what's going on with the teen clinic? So I assume you've been open. Was it closed for a while and then open when school began back, or was it?
No, it's never really been closed. Yeah. It was.
This is at CR here in Crescent City.
Yeah,
right?
it's on the CR campus right across the street. You can't miss it, although a lot of people do. But it's got a big sign, like a huge sign.
It says Teen Clinic.
Yeah. So, during the initial lockdown in March 2020, we were brought into the mothership. Although we were safer, I think, where we were.
Right.
But,
probably. Yeah.
Because the numbers kind of haven't really super recovered since then, although they're just starting to, maybe the last month, because I think the kids are actually on campus.
Right.
So, yeah, it's exciting. We got a bunch of new people. We have depot. We have birth control pills. We have, I can put in and take out Nexplanons, which is the progesterone-only method that goes in the arm. And I can prescribe patches. I can give morning after pills. We give out tons of. We have really cool condoms. So.
What makes them cool?
Marketing. Yeah, we have a bunch of sizes and varieties for whatever anybody wants. We definitely got them.
I can testify.
Yes.
Back in high school, I went to the teen clinic, and my partner asked for condoms and was given a giant bag.
A giant bag. Okay. Wow.
Yeah.
All right.
We take
Lasted me for several years.
for years.
And today you get cookies too.
Yeah. Well, not today. That's going to be next week.
Oh, I thought you were starting today.
No,
I thought you said.
No, this is just an idea I had yesterday. So I have to work my way through all the powers that be.
Right. You got to go to the cookie committee and get the okay, and then the condom committee.
Right, sure, yeah.
Exactly.
Yeah, the other marketing that gets used is the mediums are the ones that are labeled medium are actually small, and the ones that are labeled large are actually medium.
Yeah, I think there might be some body dysmorphia.
They got rid of the medium. Yeah. It's no longer it's like soft drinks.
We have large ones. We won't mock you if you have to come in and ask for a large one. So, yeah. But let me also say that I'm happily taking care of women and men who are out of their teen years, and there's a little bit of chlamydia and gonorrhea going around.
Oh my gosh! Okay.
We can totally test for all that.
So is there
treat you.
What's the rubric then? I mean, when are you no longer able to go to the teen clinic?
Never. I sneak my friends in there all the time.
Okay.
Maybe they had different rules before, but I'm a Planned Parenthood alum.
Yeah.
I want shots in arms, and I want people to have choice. So there you go.
So then, I realize we're probably close to out of time, but so you were talking about STDs being transmitted now. Is that normal here, or is that something that's different?
Oh, Del Norte's well known for its chlamydia, and we're having a little run of gonorrhea right now, and and a lot of people don't see the risk. And so they're surprised. So I think there's a lot of infections that go untreated for a while, which of course for both men and women is a fertility risk. So I'm pretty much testing everybody now. And then of course we can test for HIV. We can test for Hep C, which is up here. Hep B, of course, pretty much falling by the wayside with good immunization. Syphilis making a little bump in the community in the past year or so. So I can test for all that, and I can arrange treatment for people that are at risk. So.
I don't like the fact that we're known for our STDs up here. It's really disappointing. Wow.
Yeah.
All right. Well, Lynn Szabo, thank you so very much. Thanks for catching us up with all the, because I think about every once in a while, hey, what's up with the booster shots? Do I need to worry about that yet? So it's nice to have all this information laid out for us, and then all the other fun stuff happening at the teen clinic.
Remember, third jab and booster, different things.
Yeah.
But thanks. Another opportunity to point that out.
And we've gone over what that difference is and who that affects. Yeah. So that's it for this week's Health Matters. I guess we'll see you next week then.
Thank you.
All right. Thank you very much.
Of all the radio stations that tell you they love you, we mean it. KFUG.